Excellent. So, first of all, I would like to introduce you to two great ladies. It's Elisa Stelli and Irina Thiery from Romania. So, Elisa is a third-year midwifery student. She's based in London, and she's a board member of the Lion Mentor Association, and you will know more about it. She's originally from Romania, and she would like to improve birth in her home country. And you will get to know how. Irina is living in Bucharest, in Romania, and she used to live in Boston for many years. But now she's back in Romania since 2009. And she's one of the founders of the Lion Mentor Association. So I would say both of them are human rights activists, and I'm looking forward to listen to you. So over to Irina and Elisa.
Hello, good morning everyone, or good afternoon, depending on which part of the world you're watching from. Thank you for the introduction, Michaela. Now I'd like to wish a happy International Midwife Day to everyone who's either a midwife, doula, educator, or interested in birth. My name is Elisa. I'm originally from Romania. I've moved to London 8 years ago, and I'm currently in my third year studying midwifery. I'm studying midwifery at St. George's and Kingston University in London. Until recently, I wasn't aware of the maternity and birth situation in Romania.
I cannot hear you. Sorry, your microphone.
Yeah, I've always been very passionate about human rights in childbirth, and I strongly believe that every woman should have the right to a dignifying and empowering positive birth, being who she gives birth in or how she gives birth. After meeting several midwives from Romania in my UK tour as becoming a midwife and doing a broad literature research about birth in Romania, I have become very passionate about improving birth in my home country, even though I'm not planning to practice there. For me, it has become very clear that pregnancy and birth here in Romania are very medicalized, obstetric violence very common, and the majority of women are terrified of giving birth. I have recently become a board member of the Lion Mentor Association, which is a Romanian non-governmental organization that fights for women's rights and are working towards empowering women through giving them information, sharing positive stories, and making them aware of their basic human rights, which are not respected at present in maternity settings. But Irina will talk about Lion Mentor Association more in depth. So our presentation will include a bit about Romania, because probably some of you don't know much about the location, demographics, and healthcare system provision. We will discuss a little bit about the influences of communism on the healthcare system, on women's health and reproductive rights, and on the feminism in general. We'll touch a bit on the history and some key points of midwifery profession in Romania. And then Irina will discuss more about the current situation, statistics, and as I mentioned, she will discuss more in detail about what Lion Mentor Association does for birth in Romania. Before we start, I would like to read you a testimonial of Minola, which is a doula, a mother, and antenatal educator in Romania. This letter was sent to us by her, and it's about her birth story and how she felt. So these are her words. I gave birth vaginally with an epidural, on my request, although no one informed me on the implication of having one. I had an elbow pressing on my uterus before I gave birth. I had a routine prophylactic episiotomy. My newborn baby only skin to skin for a few seconds. They said my birth was a textbook birth in their opinion. But in my opinion, if that was the case, that was a very badly written textbook. The midwives were all screaming and shouting at me to breathe as they tell me, to keep my bottom on the bed when pushing. I gave birth at 7 in the morning. They took my baby away very shortly after giving birth. I was left on the obstetric table, where for 1 hour I vigorously massaged my uterus. At one point, I was in so much pain, I thought I was giving birth again. Actually, what was happening was that my bladder was very full.
Your voice is cutting.
And because I had an epidural, I did not have the sensation
now it's
and
better.
the need
Can you speak again, please?
to go to the toilet.
Can you continue?
I was screaming for help for a long time, asking for a commode to be brought so that I can empty my bladder. I had to wait for a long time when I thought.
Elisa, we cannot hear you clearly. Can you hear me? Because we can't hear you.
Yes, I can hear you.
Can you check your internet?
Yes, I can hear you.
Yeah, Elisa,
Yeah, just bear with me 1 second.
Okay, you can hear me. Excellent. Your voice is cutting, so is your internet connection stable?
Yes. Can you hear me now?
Yeah. So yeah, you just continue, and I will just maybe interrupt if we cannot hear you again. Okay. Okay, please continue. Sorry.
Around 12 in the afternoon, they took me out of the labor room, and around 4:30, I have finally seen my baby again. After begging them to let me see him. My baby was a perfectly healthy term baby with no complications. In the first night, they told me, "We are taking your baby away so that you can sleep overnight." But of course, I could not
Can you
sleep
get
at all,
close to?
as I was constantly wondering what my baby was doing.
Your wireless connection?
The option was telling the mothers to give informal payments to the midwife as well, pay extra, because they think that this is how it should be.
We can hear you on and off.
Can you hear me?
Could you get closer? Maybe if there's if you're using the wireless, can you get closer to the wireless connection? Or if you use a plug, maybe can you check the plug, because it's coming. Your voice is coming.
Yeah. Yes. Sorry about. Let me try that. Yeah.
Sure.
Hey, can you hear me better now?
Yes, let's try. Yeah. Okay, let's go on.
Why do we pay to be shouted at and to be treated like this?
Elisa?
Or even after the moment of birth, when those are the most precious moments between a mom and her baby. Why does the baby have to be taken routinely away to the neonatal wards, only to be for which the mothers don't even consent to be given to their baby? Are we still having a problem?
Yes, it's your voice is coming and going. So are you close to your wireless connection? Are you really close to it?
Yeah, I'm next.
Or maybe somebody's downloading something? Okay. Nobody's downloading anything.
There's no why.
Yeah, and nobody else is downloading anything.
No, it's just Irina in the same room, but yeah.
Okay.
What we can try?
Yeah, Chris is asking, are you using
closing, because we're both connected in the same. Yeah, we're using a headset. Yeah.
Yeah. Maybe you could also switch one computer off and just do a presentation on one computer. What do you think?
Yeah, from one computer. Yeah, let's try that.
Yeah.
Irina will try to log off now and switch her computer off and see if we have a better connection.
And then, yeah.
Okay, Irina just stopped her her connection. Is there any difference now? Someone was saying that I can hear you now.
Let's continue.
Is it better now? Yeah, I'm really sorry that you couldn't hear the story, as it's a very powerful story. I really wanted you to be able to hear it, as it gives a clear definition of the values and the system of birth in Romania, and about the dignity that doesn't really exist around birth. I might try to read just quickly a few slides from the testimony, because I really want you to get a clear idea about it. So the testimony, as I said, was from one of our doula, who's a mother and antenatal educator. I won't read it all over again. I will just read a few main points. So this lady was, I will just make a resume. This lady gave birth. She wasn't informed at all of, she wanted an epidural. She wasn't informed at all of the risk or complications. Her baby was taken away straight after birth to the neonatal unit, although the baby was healthy and no problems at birth. Unfortunately, the practice in Romania is still for the babies to be separated at birth from the mothers. This lady gave birth at 7 in the morning, and she only managed to see her baby for a few seconds. And then she was begging to see her baby, and she had to wait until 4 in the afternoon to be able to see her baby again, which is very sad. The Romanian maternity healthcare system is very different than what I'm experiencing in the UK, and what probably all of you are experiencing in countries where midwifery profession is a strong profession.
Elisa, the sound is cutting again.
Irina will talk more in detail about it, but just Can you hear me now? It's just me connected to the internet. Can you hear me better now?
Yeah, we could hear you now, but it's cutting, so it's coming and going. So maybe you could also just plug out the microphone and
unplug
talk without the. Try it. Maybe it's working.
Okay, let me try that. Okay, I've just plugged out the microphone. Can you hear me? Is there any difference now?
Yeah, it's good. Yeah, good. Let's go on. Yeah.
Is it better now?
Let's go on. Yeah.
Okay, I'm really sorry about all these technical problems. Okay, so I just wanted to point out a few main differences, which Irina will talk more in detail about. So in UK and probably in other parts of the world, the midwives practice independent and autonomous, and they provide natal, intrapartum, and postnatal care. Well, in Romania, the situation is completely different. There's no antenatal care provided by midwives, although they do have qualified midwives to do that. The intrapartum care, very rarely a midwife is allowed to be present for birth, and if that happens, there has to be an obstetrician there as well when that happens. Postnatal care is not provided by a midwife either. So in a way, midwifery doesn't really exist as it should be in Romania. That's happening, and there are some very strong midwives in Romania that are trying to bring about change. But I'll let Irina talk about it. I'm going to start by just a few general things about Romania. So Romania is one of the largest countries of the European Union, and it's located at crossroads of Eastern Europe. In 2014, the population of Romania was reported to be 9 19.91 million. According to the World Health Organization, Romania has gone through some rapid major transformation after the revolution in 1980. After the revolution in December 1989, Romanian political system shifted from communism towards democracy, and Romania became a republic. The health status of people in Romania is considered to be poor. If we compare the health status with other European countries, with other EU countries, life expectancy in Romania is considerably shorter, 71 years for men and 78 years for women. As I mentioned, there was a revolution in 1989 when the communism was knocked out completely. But there are some still very strong influences of the communist period dominate the medical field. They dominate women's rights. So in 1960, Romania was faced with a reproductive health crisis. So because there was a fertility decline, the Ceausescu government in 1960 tried to reverse the country's fertility decline by outlawing abortion and restricting all means of contraception, and also launching a propaganda against hormonal contraception. To avoid unplanned births, many women resorted to illegal abortions, most of them self-induced or performed by an untrained individual under unsafe conditions. This contributed to Romania having the highest maternal death rate in Europe at that time. So we think that there is a strong link between the fact that the women were used to be controlled for so many years and the fact that women are still accepting to be controlled and are not trying to fight for their options and their choices. And as well, during the communist period, the healthcare system was for everyone, but it had a downside of providing no choice to people when seeking health services. And it was very much a very doctor-focused medical system. So no one had the right to question the doctors or the medical professions. No one had any choices or options. And again, I think that still has a very that had a very strong influence, and we can still feel the impact of that period even now in the healthcare system. Okay, so some history and some key points in midwifery in Romania. So starting with 1960, the traditional birth attendants were forbidden to attend births in Romania. And of course, pregnant women found themselves forced to give birth in hospital. The highly respected village figure, the midwife, became a cultural phenomenon that made her more of a legend character. All midwifery schools were abolished in 1978, and the role of the midwife was taken over by a general nurse with a short period of on-site training in obstetric and gynecology. In 2003, the Ministry of Health reintroduced the midwifery profession, and the midwifery program at university level was established with a curriculum and training periods in compliance with the EU requirements. So because there was such a big gap in the history of midwifery profession from 1978, where there was no midwifery training at all until 2004, I think that also contributes to the fact that midwifery profession is not a strong profession in Romania, and it's not fully understood. There's a lot of confusion between what a midwife is and what a midwife can or cannot do, and what an obstetric nurse is. So at present, midwifery care and home births only exist in the memories of a few older women, and practiced by the occasional isolated revolutionary midwife. Midwifery care was phased out with the growth of a medicalized approach to childbirth. Almost all births take place in hospital and are attended by obstetrician, with midwife very sadly in attendance of the doctor rather than the mother. Care is very technically and task-orientated. There are a lot of interventions in pregnancy as well. If I compare what I've read about Romanian practice and heard, even starting with blood tests, there's a lot of scanning. At every appointment with obstetrician, there is a scan happening. There are vaginal examinations happening in pregnancy. So a lot of practice that, for me, coming with a point of view and experiencing midwifery care in the UK, a lot of it is unnecessary, as it doesn't, if we look at the mortality rates, we don't really see any improvements. I will let Irina now to tell you more about midwifery at present in Romania. She's more aware living in Romania. She's more aware of the actual situation. We're just gonna have to make a switch between us, so just bear with us.
Hello everyone, can everybody hear me?
We can hear you well.
Oh, very good. Okay, so my name is Irina Thiery and I'm the president of Lion Mentor Association, which I founded in 2013. As Elisa already mentioned, Lion Mentor fights for women's rights by informing them of their options at birth through documentaries, screenings, and all over the country, as well as through articles on our website. At base, I'm a film producer, and in 2014, after the birth of my children, I produced the first Romanian documentary, Audacity of Childbearing, describing the traumatic, abusive medical practices in Romania. The documentary raises awareness and educates women about their rights at birth, helps women over birth, and educates medical staff to treat screen in 22 cities around the world, around the country. We live in a post-industrial society organized around an ideology of technological progress, developing high-tech and global flow of information. We have such dominant nature of technology that we completely lost touch with what nature actually is, especially in terms of our body. Thus, it is no wonder that birth is no longer regarded as a physiological process. We are afraid of natural birth because it is perceived as something out of control. Even doctors they call it primitive, which is why we intrude in this physiological process with all sorts of unnecessary interventions. Technology is used to give the impression that we